Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started.
Picture this. A woman I'll call Maria went into the hospital for a scheduled procedure. She signed the consent form while groggy after a long wait, then woke up to find a slightly different procedure had been done. She felt betrayed and helpless. The team pointed to the signed form and said it covered everything. Maria asked me later, if I signed it, wasn't that my consent? That question is exactly why this episode matters. A signature on a form doesn't always mean the patient truly understood or freely agreed to what happened. Today, we'll make sense of that gap.
Promise and overview. In the next 20 minutes, I'll walk you through the basics of informed consent in plain language. You'll learn the 4 legal and ethical elements clinicians should meet, quick checks to know whether someone has decision-making capacity, ready-to-use scripts to ask the right questions, and practical steps to pause or withdraw consent if plans change. I'll also cover common special situations, minors, language barriers, and emergencies, and give you clear next steps to protect your rights. This is practical, not legal advice, and I'll remind you when it's important to consult local resources.
Section 1. Consent Basics and the 4 Elements. Let's start with a plain definition. Informed consent is a process, not just a signed piece of paper. Legally and ethically, it's how a clinician discloses information, checks that the patient understands it, confirms that the choice is voluntary, and ensures the patient has capacity to decide. Remember, a signature documents that a discussion happened, but it doesn't prove the discussion met those 4 elements. Why that distinction matters. Hospitals use consent forms for record keeping, but courts and ethics committees will look at the quality of communication. If a patient was rushed, sedated, speaking a different language, or pressured, a signature may not stand up as valid consent. The 4 elements in plain language. Disclosure. Did the clinician explain the nature of the intervention, the expected benefits, the significant risks, and reasonable alternatives, including the option of doing nothing? Concretely, you should be told the main goal of the treatment, likely outcomes, and what could go wrong. Comprehension. Did you actually understand that explanation? This means the clinician uses language you understand, checks for understanding, and answers your follow-up questions. Voluntariness. Was your decision free from coercion, manipulation, or inappropriate pressure? A rush timeline or a statement like, if you don't do this, I won't continue to treat you, is a red flag. Capacity. Do you have the mental ability to make this decision now? Capacity requires understanding, retaining information, weighing options, and communicating a choice. If one of these pieces is missing, the consent may be invalid. Red flags to listen for. Contradictory or vague explanations, trust me without details, refusal to give you a plain English summary, refusal to involve an interpreter when you ask for one, or being asked to sign while sedated or emotionally overwhelmed. If any of that happens, pause and ask for clarification or a delay.
Section 2. Practical scripts and questions to use right now. I want to give you language you can use today. These are short, direct scripts that work in clinic, the emergency department, or before surgery. Use your voice. Practice these aloud if you need to. Before a procedure, can you explain the main goal of this procedure in one sentence? Short pause. What are the top 3 risks I should be worried about, and how likely are they? What are my alternatives, including the option to wait or do nothing? If this is for pain, how likely is this to improve my pain, and for how long? What will recovery look like day to day? If the explanation is full of jargon, can you explain that in plain English for me? If you don't understand, I'm not comfortable signing until I understand. Can you show me where it says that in the form? If you need time, I'd like to take 24 hours to think about this. Can you give me written information and a contact to answer follow-up questions? Many clinicians can and will accommodate reasonable time requests. If someone pushes back, that's a red flag. Scripts for when something changes mid-care. I consented to X, but I did not consent to Y. Please stop and clarify. If a provider says they need to do something additional, please explain why that extra step is needed and give me time to decide. When capacity is a concern, ask simple, direct questions to check understanding. Can you tell me in your own words why the doctor recommended this? What do you think will happen if we don't do this? If the answers make sense, capacity is likely present. If someone cannot repeat back the basic facts or seems confused, ask for a formal capacity assessment and involve the care team or a social worker.
Section 3. Special situations and withdrawing consent. A few quick rules for special cases. Minors and surrogates. Parents or legal guardians usually make decisions for minors, but mature minor rules vary by state. Adolescents may consent for specific services, like contraception or mental health care in some places. If a guardian's decision conflicts with the child's best interests, ask to speak with the ethics committee or patient advocate. Language barriers, interpreters. Always ask for a certified medical interpreter, not a family member, when discussions are significant. Interpreters should translate everything the provider says and what you say in full. If the team refuses, ask for the hospital's language services department or patient advocate. Emergencies and implied consent. In life-threatening emergencies where immediate action is needed to prevent death or serious harm, clinicians can act without formal consent. That's called implied consent. But once the emergency stabilizes, clinicians should explain what was done and why, and document the justification. Withdrawing consent. You can stop treatment at any time, even if you previously agreed. Use a clear statement, such as, "I withdraw consent for this procedure treatment effective immediately." Ask the care team to document the withdrawal in your record and request a copy. If they don't document it, ask to speak with the charge nurse or patient advocate and note the time, names, and what was said. If you fear coercion or unsafe behavior, escalate to patient safety, risk management, or seek legal counsel. Documentation to request. Ask for a copy of the signed consent form, any written information provided, and the procedure note once available. If you're concerned later, those records help your questions get answered.
Important disclaimer. I want to be clear. This episode is educational and not a substitute for legal advice. Laws and hospital policies vary by state and institution. If you face a high-stakes decision or believe your rights were violated, consult a local patient advocate, your attorney, or the hospital's risk or ethics department. That said, these practical steps and scripts will help you have clearer conversations right away. Recap and 3 takeaways. First, informed consent is a process, not just a signature. Make sure the disclosure, comprehension, voluntariness, and capacity pieces are present. Second, use short, direct scripts. Ask for the one-sentence goal, the top 3 risks, reasonable alternatives, and plain language explanations. Ask for time when you need it. Third, you can pause or withdraw consent at any time. Ask for documentation and escalate to patient advocacy if you feel pressured. Next steps you can take right now. Save these scripts in your phone notes. Ask for a certified interpreter when needed, and request copies of consent forms for your records. If you're preparing for a procedure, bring a support person and write down your questions in advance. If this episode helped you feel more confident about medical conversations, please subscribe to FAQ by Nurse Jessi for more practical healthcare guidance. Share this episode with anyone who might need a reminder that they have rights at the bedside. And if you want deeper help on a complex situation, learn more at FAQbyNurseJessiConsulting.com, where I work with patients, families, and professionals to clarify medical facts behind legal questions. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQbyNurseJessConsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.